With Hillary Clinton's health becoming an issue, how much of a concern is this latest episode? Dr. Debbie joins me now with a closer look in studio, and nice to see you. Welcome back here. You have not seen her or treated her, as a caveat, we should mention that.
Sure.
But there are different types of pneumonia in medicine.
Yeah, so they usually get grouped into two large categories of bacterial and viral pneumonias. Now, there's also a range of whether they're mild or severe. So a lot of that depends on the type of pathogen that you're dealing with and also the health of the candidate. If someone's healthier, they tend to bounce back from a pneumonia more easily, whereas someone who, let's say they're a smoker, they're debilitated, they have some underlying medical problems, it can take longer for them to recover.
So if you have pneumonia, you can get dehydrated.
Of course.
You can feel unsteady.
Yeah, there are several reasons too. I mean, people can get unsteady when they have less oxygen or blood flow to the brain. So if you have pneumonia and that's affecting your oxygen level to begin with, you know, you're already sort of limited there. And then second, you tend to get dehydrated when you're sick. You don't take in as many fluids, so that can lower your blood pressure. And especially if you're on antibiotics, a lot of people get nauseated, they might feel like vomiting, maybe some diarrhea. So again, reasons to lose fluid.
And it's our understanding that she did go on antibiotics, but she's also on a blood thinner called Coumadin. Is that advisable?
Well,
are there dangers?
There are things to watch out for. So if you have pneumonia, it's better to be on antibiotics, at least at first, even if you have something viral, because it can turn into something bacterial. But of course, the antibiotics can interact with Coumadin, so you have to watch the levels closely. So essentially, if you change your diet, either because you're dehydrated, you're not eating as much, or if you're on antibiotics, your Coumadin level can either go up or down, depending on what's going on. So you have to watch that in the coming days, because you want to make sure that it's effective.
Yeah, but you and a physician watch that too. Recovery time on pneumonia or walking pneumonia or whatever the category is how long? It
really depends. You know, for some people they can get better with the antibiotics. They can feel significantly better within even a day or two, but other people it can go on for a lot longer. Now with walking pneumonia, that's usually referring to a specific type of bacteria, but looking at Mrs. Clinton, she seems to be able to walk around with the pneumonia.
Would the coughing episodes be related to this, or would that be a separate matter?
I think it's probably related. I mean, she said she had allergies, so I know they're saying that perhaps she had the allergies and then she got super infected with a pneumonia. It could also go the other way. Sometimes you have an infection, and then because you have allergies, your body's having a response to that, so it tends to persist a little longer. So that might be why she had the coughing fit before.
Right. Well, thank you for coming in today. Thank you, Doctor.
Thanks.
Nice to see you, Dr.
Good to see you too, Bill.